Hello everyone, my name is Chris Macoloo, the Regional Director for East Africa at World Neighbors. World Neighbors is an international development organization with headquarters in Oklahoma City and working with marginalized rural communities in Africa, Asia, Latin America and the Caribbean. We work with communities to be able to be food secure, to live healthy lives and to manage their natural resources sustainably. My paper is entitled Using Leaky Tins to Improve Community Health in Rural Tanzania. Poverty and disease burden are related. In fact, poor people tend to fall sick more easily. And Africa, sub-Saharan Africa accounts for over 70% of the world's poorest people, and therefore disease prevalence is also high in Africa. These are due to a number of factors. One is that access to safe and clean water is limited, and over 400 million people lack access to clean drinking water. Women and girls therefore travel long distances to fetch water for domestic use. Sanitation facilities are equally poor, hence diarrheal diseases are prevalent. Over 300,000 deaths of children under 5 per year are due to diarrheal diseases. Most of these diseases can actually be prevented through regular hand washing and positive public health forms of behavior. Now, what is the situation in Tanzania like, rural Tanzania? We find that in rural Tanzania, we are working in 2 districts, Tarime and Rorya districts, which are close to Lake Victoria. And here, over 70% of the people lack access to safe and clean water. And here, women and girls travel over 5 kilometers daily to fetch water for domestic use. Sanitation is also an issue. Over 50% of the people or households don't have sanitation facilities, and therefore open defecation is very common, which hence in polluting the limited water resources that they have. So waterborne diseases are very prevalent. And therefore the deaths of about 9% of the deaths in children are attributed to diarrheal diseases. And this also happens to about 5% of deaths in the adult population. Now, due to scarcity of water, people don't wash their hands very regularly. The water that is brought home is used for key domestic purposes like cooking. And because of this, families and households spend up to 40% of their incomes in treating preventable waterborne diseases. Now, how has World Neighbors been working with these communities to reduce the disease burden? World Neighbors has worked in this community with consisting of 27 villages with 9,000 active program participants, and therefore reaching about 80,000 beneficiaries. We have worked with these communities between the year 2006 to the year 2021 when we phased out. World Neighbors introduced a multi-pronged approach to address the issues of health. The first approach that we adopted is to, together with the Ministry of Health, we sponsor regular mobile health clinics where we go and bring health services to the community level, where we test them for diseases like malaria, diarrhea, and we treat them. But the ones that are very complex, we refer to hospitals so that they can get better treatment. The second strategy is the use with the school administration. We have formed school health clubs where students come together to discuss and to have knowledge about health issues. Here, they are taught about things like how to keep healthy, how to avoid early pregnancies, how to avoid HIV and AIDS, how to avoid STIs, that is sexually transmitted infections, and also to avoid harmful cultural practices like female genital mutilation. We have worked with 12 school health clubs with about 1,500 students who have been taught about basic health activities. The third strategy is that with the village, with the communities, we have formed what are called village health clubs, because just concentrating on the students may not be good enough. So we're also concentrating on, we're also focusing on their parents. And so the parents also come together to discuss issues to do with health. And to help us do this, we use the facilities of the people the cadre of people that we call community health volunteers. These are people that live in the community, and we have trained them. They have extra information about health, and so they go from household to household, raising their awareness and answering questions about health. Now, the village health clubs became very, very important, particularly during the COVID-19 pandemic, when schools were closed, and therefore the students who are in the school health clubs now joined their parents in the village health clubs to be able to continue with the health activities. We realized that we had to do something innovative. So we introduced what we call leaky tins or tippy taps. Tippy taps are a jerrycan, 2 to 5 liters of jerrycan filled with water and suspended from a wooden frame and operated by the foot for washing hands. Leaky tins are simple to install and are erected outside latrines, and soap and detergents are available for washing of hands. Leaky tins use less water, about 50 milliliters, than conventional tap water that you would require, about 500 milliliters. So they are very economical to use, and currently 80% of the households have tippy taps, have leaky tins installed, and they are using them. Now, after this intervention by World Neighbors, what is the impact? We have had some very, very good impact. One, that there's been reduction in waterborne diseases. And this has resulted in low morbidity and mortality rates, and therefore reducing household expenses on treating preventable diseases. The second impact is the behavior change. Washing hands and after using latrines, and even using latrines themselves, has become very common in the community, and therefore people have changed their behavior, where they used to eat without washing hands. After coming from the toilet, they didn't wash their hands, so the behavior has actually changed. And even younger children who are not going to school yet learn from their siblings who come from school, and we hope that because they are young, if they begin to change the behavior now, they'll carry this into adulthood. Thirdly, there's reduction in student absenteeism, because the students don't fall sick very easily, very frequently. Now they attend classes very well, and absenteeism has been reduced by 40%. The fourth impact is about the emerging innovation and entrepreneurship. Due to the increased demand for soap for washing hands, when we use leaky tins, groups and individuals have begun to make soap for washing their hands in the villages. And these are cheaper. They use local materials, and these are cheaper than soap bought in from the shops. And one important innovation that has come out from the villagers is the manufacture of liquid detergent by using ash. Here you take about a half kilogram of ash, and then you put in a container, and you pour 1 liter of water into the container. Is perforated at the bottom, so when you pour water, the water drips down to a second container, and the liquid that comes out is put in bottles and is very, very good detergent for washing hands. Finally, there's been a reduction in the spread of COVID-19. As you know, the management of COVID-19 depends on personal hygiene, and because we have worked hard to make sure that people wash their hands in the communities that we work with through the use of leaky tins, this has permeated through the whole community, and therefore reduced the rate at which COVID-19 has spread amongst the communities that we work with in Tanzania. Now, in conclusion, I would want to emphasize that there still need to be more work done to achieve some sustainable development goals that are very relevant to the work that we are doing. Sustainable development goal number 3 looks at good health and well-being. And sustainable goal number 6 looks at clean water and sanitation. So more work still needs to be done so that we can be sure that we are going to achieve those 2 goals. The second thing that I would want to emphasize is that policies that aim at poverty reduction must also be put in place, because at the beginning I mentioned that poverty is related to low health indicators. Another area that needs to be emphasized is community health strategy. The governments must emphasize and implement community health strategy, which is focused mainly on preventive aspects of health rather than curative, because people walk long distances to hospitals. If you have preventive care where community health volunteers work with the villagers, that would really help in reducing diseases. Finally, we want to appeal to the governments to support innovation, encourage and support innovation at the community level. As we have seen, things like Leaky tins and the production of soap at the village level have made great change in the health of the communities in rural Tanzania. And these technologies can be very easily scaled out and replicated in other areas. Thank you very much for listening to the presentation.